Dear viewers, Assalamu alaikum. I'm Dr. Adil Riaz, consultant radiologist at Ilyas Medicare and Diagnostic Center. A viewer of mine, Mr. Kumar Mishra, has asked me to that how we will differentiate in internal echoes, debris, and hematoma in a fluid-filled structure like urinary bladder or gallbladder. So today I'm going to demonstrate this thing. For this purpose, I will be using my linear array probe, and I have made two phantoms for this purpose. One for internal echoes and debris, and the other for hematoma. So first of all, here you can see the particles moving within the fluid. These all are internal echoes, and when these particles will settle down and will make a layer downward, here we will call it debris. You can see that these particles are falling down, and here you will be able to see the movement in the layer of debris also. When I will here you can see the particles are moving in the dependent area. So when these particles are heavy and they got settled down, it is called debris. You can see the movement of the debris here. And now coming to the hematoma, when you see an echogenic structure which may be giving a posterior acoustic shadow or may not be giving it, it might be giving a soft tissue echogenicity along the dependent wall of the fluid filled structure, it is the hematoma. And how to differentiate in a hematoma and a soft tissue mass? Because I will move my object, or I will ask my patient to tilt to one side, and the structure will again go to the dependent area. Here you can see that the echogenic structure has moved again to the dependent area. It will move with the movement of, here you can see it moving, sliding along the dependent wall. A mass will never move. It will not depend upon the change of posture of the patient. It will remain stick to its wall from which it's originating, while a hematoma will keep on moving with the change of posture. So this is how we differentiate in internal echoes, debris, and hematoma. Thanks for watching. Your feedback is very important. If you want to have ask any question, do let me know. I will make a video about that. Till that time, keep on watching. Do like, share, and subscribe to my channel. Thank you so much. Allah Hafiz.